This is the lecture for Obesity, Energy Balance, and Weight Management for Exercise Science 219. So obesity is a common problem and something that I'm sure all of you are familiar with, but here are some specific statistics for the state of Tennessee that I thought were really interesting. So staying fairly on par with the American average of that 1 in 3 being overweight or obese, we see 67% are overweight, and 31% of those are obese. Now, as far as adolescents, we're really concerned about this because we have 16% are overweight and 16% are obese, and a lot of that has to do with lack of physical activity. Now, too much body fat do increase a lot of the health risks we've discussed this semester. So we've talked about obesity being a risk factor for many of these as far as cardiovascular disease, heart disease, diabetes, but a lot of things that people don't often think about are sleep disorders, such as sleep apnea, where you go through periods of not being able to breathe while you're asleep. Increases your risk for multiple types of cancer. You have a harder time fighting off diseases whenever you are obese. We see poor wound healing and more surgical complications. Some of you may be familiar with this, but there are two different ways to calculate body mass index, and that is one thing we're going to talk about in this class is BMI. So you're going to have to know how to calculate this for your final exam and for some of your practice calculation problems. You may use whichever formula you are most familiar with. I will go ahead and tell you that for some odd reason, when people use the bottom one when in pounds and inches, I don't know what really happens, but people tend to go wrong somewhere. But do what's comfortable for you. So if you've already learned one, continue with that one. If not, I would highly recommend using the one on top. Now, for the final exam, I do give you the weight in both pounds and kilograms and the height in both inches and meters so that you don't have to do those calculations. So you would just choose whichever formula you're more comfortable with, but those will already be calculated for you. But I would prefer, and I prefer to use kilograms and meters. So practice with this a couple times. You may want to stop the video and do a couple practice calculations. You will see this on your body weight case study, and we're going to be going over this more in depth tomorrow. I just want you to be familiar with it. So here's a good practice problem for you to stop the video and work on. Takes you through it step by step. Like I said, I do prefer that kilograms and meters calculation. This does, however, show you the pounds and inches calculation. This is another thing that you're going to have to do, so you may want to pause the video. I would like for you to create a chart in your notebook, similar to the physiological fuel values chart, where it's a study guide for you, with these categories. There are a lot of things that you will not have to memorize for the final exam, including all of the formulas we're going to go over and you're going to practice calculations with. The one thing you will have to memorize is these categories, and we're going to go over them tomorrow in class and make sure everybody's really clear on them. But go ahead and make that chart now. You'll need to know that underweight is less than 18.5. Normal is between 18.5 and 24.9. Overweight is over 25 to 30. Normally that's like a 29.9, because over 30 you have obesity. Now, don't worry about having the morbid or extreme obesity. Just know that 30 and above is obesity. So let's talk a little bit about body fat. Fat in our body is stored in two different places, and we know a lot of times that's due to excess calories. We've talked about how glucose goes to the liver to be converted to glycogen, but that's only so much that can be stored, right? And so a lot of times what we see with that excess glucose is it's either excreted or it's transferred to fat cells or adipocytes to be stored in the body. And we also have that extra fat also is stored in the body. So what we're concerned about is the way these two places, where the fat is stored in two places, because visceral fat is a bigger problem. We often see that the visceral fat being under that layer of muscle, so in like hips, arms, and thighs, it's more metabolically active, but also more strongly related to chronic inflammation. With subcutaneous fat, we see it stored in the abdomen, just right under the skin, so between the skin and the muscle. And that creates two different body shapes. So a lot of times you can tell in the way somebody stores their fat typically in their body is if they carry that higher around the center. And that typically is where we see that subcutaneous fat compared to the visceral fat. Now, unfortunately, with the subcutaneous fat storage, with that obesity and then the visceral obesity, we often see what we call metabolic syndrome. And remember how we talked about so far in class how all these things are related. These low HDLs are the good cholesterol, high triglycerides in your body, hypertension or high blood pressure, insulin resistance, which is strongly related to type 2 diabetes. And so a lot of times when you put these combination of factors together, they call it metabolic syndrome, putting you at great risk for developing these long-term chronic diseases like cardiovascular disease that are related to having these, and we often see them together. Now, we measure body fat content in a variety of ways. Some of these are very easy, don't need much equipment, skin fold thickness measures, so that's kind of where it pinches your skin. A bioelectrical impedance analysis, or BIA, is often what you see when you have people do the handheld. Used to be that we did underwater weighing. MRIs and DEXAs are very expensive and by far the most expensive way, but the most accurate to measure body fat content is the body air displacement with the bod pod, which is actually what you're seeing there in the middle that kind of looks like an egg. We have a few of these at UT that we utilize whenever we want to really know about somebody's body composition. So one thing that's really important to know about body fat and the way that our body carries it naturally is that females tend to carry more body fat as a normal part of their health due to childbirthing years. It doesn't say that you only carry that during childbirthing years, but we tend to have that higher percentage naturally with 21 to 32%, and healthy males tend to carry about 8 to 19%. It's really important to know that with age, lean body mass decreases and body fat increases. Over the age of 30, we see your BMR change, your body mass decrease. A lot of changes naturally happen with age. So this is really blurry, but one thing that I want you guys to think about as we're going through this is energy balance. And that's why I put the scale up. Energy balance, and that balance you strike, is the ultimate way that we deal with weight loss, weight gain, and weight maintenance. It's your energy in versus your energy out. And there are a lot of skeptics to this. There are a lot of people that often say that it can't just be, strictly calories. But from the evidence we've seen, if you're simply talking about weight loss, weight maintenance, or weight gain, it really is about calories in, calories out. So when we talk about calories in, we're talking about what we're actually putting in our body. And energy out, there are multiple components of the way that we expend calories. So energy in, like I said, it's basically dietary intake. But the three things you need to know for energy out is basal metabolism, often called BMR, so your basal metabolic rate, the thermic effective food, often called TEF, TEF, and physical activity. And we're going to break those down, and I will say those definitions are extremely critical to understanding this unit. So one thing that we frequently see with energy balance is that somebody that is more active actually can change their basal metabolic rate, making your body much more efficient with what it does. So that there is some importance there in making sure your BMR is the most efficient it can be and having control over that physical activity component. So let's talk energy energy in for a second. And we already know about dietary intake. We know about the macros and the micros. However, here are some terms that help us understand some different things about our intake. First of all, hunger is, we've talked about this with food insecurity, but its definition is that it is physiological. So your actual stomach growling, you actually being hungry, right? Appetite, the difference in what that is when you have just the desire to consume the foods that often isn't necessarily linked to hunger. It can be linked to hunger, but say you're not necessarily hungry, but you always eat a certain thing while you watch TV. So those external cues of a good smell of something or you doing something that you always eat the same thing increases your appetite. And satiety is just the feeling of fullness and satisfaction caused by food consumption that eliminates the desire to eat. So you're satisfied. That's satiety. We've talked frequently about portion sizes and how those have changed over the years, and how what we consider to be a typical portion is definitely different from what we saw in 1960. All right, let's talk energy out. This is really important to make sure you get these definitions straight. Basal metabolism. It is literally all the essential functions that keep your body alive. So basically, your body expends about anywhere from about 1,400 to 1,800 calories per day just existing, doing all of those involuntary things that we don't even think about. So let's say, for example, for a weekend, you were to just exist. You were literally to do nothing else but to lay in a bed. Your body would still expend calories because of your BMR. So it does make up the largest amount of calories expended, 60 to 70%. It includes every type of bodily function except digestion and absorption. And there are many factors that affect our BMR. One thing that we already talked about is being more physically active can actually decrease your BMR and make you, increase your BMR and make you much more efficient with the way that you use your bodily functions. Stimulant drugs can also increase. Fever and illness can increase your BMR. Growth, development, lactation, pregnancy, having a leaner body mass, having a greater height and weight, all of those things increase your BMR. Now, we see your BMR decrease, on the other hand, when you're not as efficient. So you start to see that weight gain or that low caloric diet or starvation, actually, and low thyroid hormone levels. And the reason we see it with starvation is your body is going to try to take the most minimal calories you're giving it to do the bodily functions. So we do know bodies with more mass burn more kcals over time, and men burn about 1 kcal per kilogram per hour with your BMR. Women, it's about 0.9, so it's fairly similar. And this is where we get to talking about that starvation mode. In general, we don't want to drop under 1,200 kcals daily in order to keep our BMR at a good level. The reason that is let's say you're on a very strict elimination diet and you take in 1,000 kcals per day. The bare minimum that your body can run on is 1,200 for BMR. And so you teach your body over a period of 30 days that you're going to run on this 1,000 calories. Well, your body naturally adapts to that over time and says, okay, well, I guess this is all you're going to give me. So I can run your BMR on 900 kcals per day. Now, what we typically see happen with elimination diets is that after that time period, people go back to the way they normally eat and start to gorge again, also called yo-yo dieting. And so what you've done from that point forward is you've permanently changed your BMR because your body is concerned that it's going to go into starvation mode again. So it's going to continue to only need 900 kcals per day, which means that the difference there, that 200 to 300 kcals that used to be what your BMR was, is now going to be stored as extra fat. So you're actually going to cause yourself more weight gain in the long run. Another important thing to know is that your BMR naturally drops every 1% to 2% every decade after age 30. So once again, normal aging processes, we just know that the body is just not as efficient as it used to be. So here is the second definition for energy out, the thermic effect of food, or TEF. So remember how we said BMR was everything but digestion and absorption? Well, TEF is digestion and absorption. It's about 10%. And it is literally the amount of energy needed for your body to digest and absorb. It's also called diet-induced thermogenesis, but we'll refer to it as TEF in this class. One thing I'd like you to be mindful of is, if you ever heard of this, is there is such a thing as negative calorie food list, and it comes from this concept of TEF. There are certain foods that are so low calorically that it actually takes the body more energy to process it. So you have foods such as apples and blackberries. Once again, these are fruits and vegetables that are so low calorically but are also high nutrient dense that the body has to work to digest and absorb those. So our last definition for energy out is physical activity. And it's very important to know that this definitely varies based on the person. Remember those 3 pie charts we started out by looking at. And it's about 25 to 40% of the total energy expenditure. However, it is the most variable of all components. I mean, your TEF's going to stay at 10% no matter what. Your BMR, even if you increase your BMR significantly with all those factors, it's really not going to shift more than that 60 to 70%. So this is the one you have the most control over. And remember, this can include purposeful exercise, or it can also include just daily physical activity or activities of daily living. Now, how do we figure out how much energy your body needs? Well, that kind of goes into your PAL worksheet, which is an energy estimation. It's an estimated energy requirement, or EER. And that's where we look at that particular person and we look at their gender, their height, their weight, how physically active they are, and we try to determine how much calories needed for somebody. And this is a weight maintenance. So like if they just wanted to stay exactly how they were, this is how many calories they would need at the end of the day. Factors that change energy needs, we've kind of already talked about this. So males do have that higher BMR slightly due to a higher lean body mass. We see the difference in age and body comp, genetics, and we also see that with the childhood and pregnancy, we see that increased BMR. One thing I want to touch on here is genes. We talked very, very little in this class about how genetics actually affect obesity rates. We know that genetics affects other chronic diseases, right? We know it's a risk factor, but even with obesity, we are a little bit concerned. So what we have found so far is that there are over 100 genes associated with body weight management. About 20 to 30 of those we can identify as potential obesity genes right now, that produce proteins that affect how much food you eat, how much energy you expend, and the way your fat is stored in your body. Here are some particular hormones in addition to those genetics that must work efficiently and correctly in your body in order for you to have an appropriate BMR and keep weight under control. The first one is called ghrelin. I want you to remember this one as ghrelin is growling, because ghrelin is released by the stomach to stimulate the desire to eat at usual mealtime. So when it's time to eat, your stomach growls, ghrelin. That's the hormone related to that. Peptide YY is released by the GI tract after a meal. So this is a protein that is released in proportion to the number of calories consumed to try to tell us to stop eating, okay? So you take in 2,000 calories in a meal, which sounds ridiculous, but if you're eating really energy-dense, low nutrient-dense food, you might take in that much, and peptide YY is released to say, hey, stop, we're full. Now, leptin is the one that we have done a lot of research about, because we see leptin being secreted from fat cells in proportion to their size to help regulate energy intake and expenditure. The reason leptin is so important is it actually also provides another signal for the body to stop eating. So the body takes those extra cells and stores them as fat. The fat cells actually secrete leptin, and then the brain sees the increased leptin levels and says, oh, okay, like we've eaten enough that our body is now taking and moving into storage mode, stop eating. Unfortunately, this comes from the hypothalamus, and when we've done research in mice and rats, what we see is in genetically obese mice where we have altered that leptin, we see decreased leptin levels, because there's no increase in the leptin whenever it's, so basically the hypothalamus is not receiving the signal, the increased leptin signal from the adipocytes in the genetically obese mice. And so we know that there might be an issue there with obesity where the brain is not receiving the signal that leptin has increased, and thus we continue to eat. So this is something else you're going to be doing on your body weight case study. We will actually go over it again tomorrow. It's ideal body weight. We call it HOM-WE. And so we'll talk a little bit more about that tomorrow. I'm going to focus on that in class. So I'm going to kind of skip over it in the lecture. But do you know HOM-WE formula is for ideal body weight? So losing weight. So we know that we need to eat less, right? We know that we need to exercise more, or do we do both? Well, we do both of those, but also science has shown us that the most evidence we have is not just eat more or eat less calories, exercise more, but also we have to change behaviors that lead to weight gain. So feeling like we need to have dessert after dinner, or knowing that we're going to eat a bag of chips when we sit down and watch TV. So behavior change is a critical component to weight loss. We talked a little bit about weight cycling and yo-yo dieting with the BMR, but this is a really great chart that shows you how we end up having disordered eating patterns. When we do fad dieting sometimes, and when we do some of these elimination diets that are super restrictive, what we see is, yes, we do see a rapid weight loss, but we also see a decrease in BMR. People don't feel as good as they normally do, and they super crave food. And then there comes a point where they give up that diet, whether planned or unplanned, and then we often see a spike in overeating. And some of the psychological issues associated with that, with shame and guilt with the rapid weight gain, can push them into new determination for a diet. And this just continues to yo-yo back and forth. This is extremely unhealthy weight loss, and this is not how we want to encourage people to lose weight. What we want to encourage people to do is to balance their intake and output, to cut down on calories, and to increase their activity. And remembering that caloric recommendation is about 200 kcals per day or more of a reduction. So the ABCs of behavior modification, we want to back up and figure out what is prompting them to have an appetite change, right? So is it them watching TV and they love to eat potato chips? Okay, well, let's modify that behavior. Let's give them one healthy swap, like maybe if they did grapes or edamame or something that satisfied that need for that behavior without it being the negative food, can be really helpful when talking to people about that. So gaining weight, there are reasons that people gain weight. I would definitely recommend you talking to a dietitian or a doctor, or encouraging someone to do so when they're talking about gaining weight, because sometimes you just got to get in those energy-dense foods, but you also do want to think about trying to get nutrient-dense foods, which can be really difficult. To encourage muscle gain rather than fat, you definitely need to have a strength training exercise if you're thinking about wanting to gain weight for your muscles. Effective weight loss programs, remember, include that weight loss can be maintained over time, so not yo-yo dieting. Healthy weight loss, which healthy weight loss is 1 to 2 pounds per week. Healthy weight gain is 1 to 2 pounds per week. So we're not talking about 10 pounds a week. We're not talking about the extremes that we see on what was it, The Biggest Loser, some of the shows, Revenge Body, some of the shows that are really common. Those people spend all day in the gym. They spend all day in a really controlled environment. But for the average person, that's not realistic. We also want to see those changes in lifestyle patterns that led to the weight gain, so that behavior modification. So that concludes this lecture. Be prepared to go over calculations tomorrow and try to start working on your worksheets. Thank you.